this is sort of the meat and potatoes of the LOA training. It's the inspiring a motivational vision, public narrative, and call to action. So we'll be spending quite a bit of time on this, and I think you'll find it very helpful when you're forming your group or trying to get people to rejoin, say, a specific initiative that you may be working on. And I really do like this. People don't care what you know until they know that you care. And I think this is sort of the foundation and thought process of what we'll be talking about today. So many times when we talk about trying to engage people in a certain initiative, community coalition, work group that you have, you talk about using data to drive the decision making. That is one very important component of getting people engaged and proving why it's important that you work on a certain readmission reduction project or a home health care initiative that you might have. But the other part is to look at it from a personal or an emotional standpoint as to why is it really important to do this work. So we'll be fleshing that out quite a bit more today with the public narrative concept. So what I thought would be helpful is to start off our discussion today to give you an example, and this is my personal example of a public narrative and a call to action. And so then I'll be referencing that through the rest of my talk. So I'll start out with what the framework looks like from my personal statement, the public statement to the call to action, and then we'll kind of take it apart so you know how to work on your own. So my story started with my grandfather and his hospitalization after a stroke when I was about 4 years old. This really has affected me throughout my life because it actually impacted my mother and my grandmother quite a bit. At the time, there was very limited communication from the hospital staff. My grandfather was, I just remember as a small child having to go with my mother to the hospital and sit for long hours because she didn't have any childcare or anyone to take care of me. And she would occasionally, after we'd sit in the waiting room for so very, very long at the hospital, she'd take me over to my grandfather's room and she'd pick me up and have me look through this window in the door. We couldn't even go and see him, and it was a window through the door. And we'd look at him, and all I remember was a gray room with him lying there, hooked up to all these machines, and just a feeling of hopelessness. And then we go back to the waiting room and a nurse might come by and give us an update, but my grandmother and my mother would try and ask questions and she'd just walk away. And then I remember my grandfather did get a little bit better. He was discharged home, no plan of care, no home services. And I just remember the arguments and the frustration, the hurt that my family went through because nobody provided them any education or information. And at the time, there really were limited home services for them. And this was one of the many stories that why I went into social work, because I truly felt as a social worker in that profession through healthcare, you could provide education, advocacy, and those linkages that people really needed to, after they would have some sort of health incident, the support that they really needed in the community to live the life that they really needed to live. It's impacted me through the whole of my life. I feel many people have similar stories. And that's why today, through my work at Superior Health and MPRO, I'm lucky enough to work on a home health work group where, as a collaborative, competitors have come together and joined to unify to see the greater good of the patient. We've developed strategies and interventions, and now I am asking you to join me in this work. I think you'll be a wonderful partner to continue with those linkages and to carry out the mission that we have, so no patient ever has to go through what my family had to go through with my grandfather's care and the burden that my mother and my grandmother had to carry. My vision is that everyone who is discharged from the hospital truly understands what their condition is and the resources in the community to support them to stay in the community in the setting that they want to be in for as long as they can. So I hope you join me in this work today for that specific initiative. And I hope that you would like to find out more about joining our home health collaborative to continue this work. So that's my public narrative and my call to action. As you see, I even got a little emotional as I was saying it because I'm very passionate about the work. And so as we talk today, we'll talk about the components of that story in my examples. So here are our goals for our training overall: to develop a short, compelling call to action based on your leadership story, creating intentional strategies for community engagement, and utilizing best practices in building a strong, effective team. Are you seeing me advance the slides? I just want to make sure. Did I advance to the next slide? Thanks. And this is session 2, inspiring a motivation vision through public narrative and call to action. So what is a public narrative? And I'm sorry, everybody, move my panels a little bit. So a public narrative is a leadership practice through which we motivate others to join us in action. We're going to start talking about a motivating vision, which is comprised of the public narrative and a call to action. But a public narrative, it's the foundational leadership practice underpinning that snowflake model that Janelle referenced last week. And it's designed to help us motivate others to join us in action toward a specific goal or aim. So when you think about developing a call to action, it's a specific ask that you're wanting to do. It's a specific action or decision you are asking others to join you in taking. So right now, just start thinking about what would that ask be? I know a lot of people, it was wonderful at the end of our last session, we're sort of talking about what did they want people to do? Why did they join this particular teleECHO? Why did they want to learn these skills? So think about that. What would your ask be? Do you want them to join a group? Do you want to motivate your current group to continue in what they're doing? What would that be? So think about that a little bit. Some things could be that you want them to join in an intervention. We have a sepsis training. We'd love to have you join our sepsis training. And at the end, you'll be implementing a screening tool that you will be measuring outcomes on. I would like to have 3 more organizations join my collaborative so we have the full continuum of care represented. That kind of thing. Think about what you want to have as your actionable item. And so later on, when we do our breakout sessions, we'll be thinking and talking about those specific asks as part of our narrative as well. So the purpose of a public narrative, personally, I kind of like to start with the ask. And so when you're thinking about that, developing that call to action before drafting the public narrative. So I started out with my personal story and how it might translate to other people, and then my ask, my call to action. But sometimes when you're thinking of your call to action, then that drives the story you might be telling to support it. So by knowing what I'm planning on asking my audience, I'm able to tailor my public narrative to illustrate my story and connecting it with our shared values and making it relevant with the specific ask that I have. So a public narrative is motivational, and it offers a simple structure for developing a series of stories that motivates others to join you in taking collective action. It starts with mining your own personal story. So about my grandfather and my grandmother, the moments of your life story that brought you to the place of leadership in the change initiative. Why did I become a social worker? Why did I start that home health work group? Those were some of the motivating reasons why I made it very personal. So what brought you here? Why are you called to leadership in this work? What story or seminal event occurred in your life that connects you to this moment? So we tell this kind of story to help us meet the motivational challenges of the upending the status quo. We need to find and hold on to our own source of hope, and we need to encourage others to do so as well. So I just wanted to take a minute to talk about what a public narrative is not. It's not a desperate plea. It's not a sermon. It's not condescending. It's not a soapbox spiel. The practice of public narrative is very specific kind of public communication. It's about you and the connection to the work that you're inviting others to do. And so why would you need public narrative? Well, we use it in the structure and the elements of it are useful in a variety of settings. It's when you're wanting to do a one-on-one meeting, which we'll talk about in later sessions. That was sort of my framework. I was inviting a specific healthcare system to come to my home health work group because we saw a gap in that sort of knowledge base. So it might be a one-on-one meeting, very specific to a person you want to invite. Or it could be more public, like to reinvigorate your community coalition or at a town hall meeting, how to get people to join you in the work. It could be broader too. So why is it important as a leadership practice? So we call public narrative a leadership practice because it's designated to enable others to achieve shared purpose under conditions of uncertainty. And we can all relate to that in this day and age. The story you tell and the story you ask others to tell about themselves should inspire, compel, and motivate them to join your action. Your story narrates how your own leadership has been activated. The moments you assumed responsibility that weren't necessarily delegated or bestowed upon you, but they were moments that you stepped out to address a condition that persisted in a way that really just rubbed against your values, something that you really took a risk about. So leadership in uncertainty, it really does, it does require courage. It requires people to believe that challenge is worth the work and the risk involved to challenge the status quo. Knowing how to solve the problem isn't enough in these situations. People need to believe that action and solving the problem actually matters, that something is really going to change. And even when we talk about something, I know many of our coalitions that we've worked with were working around readmission reduction. Well, of course, everybody wants to reduce readmissions for people going back to the hospital. But sometimes it takes very innovative and out of the box thinking that people wouldn't necessarily think about to keep working on it and really motivate change. And sometimes that can be a little risky, even though it seems like a very status quo thing to be doing. So one example that we have here in Michigan through our work with Superior Health and MPRO in Michigan, we've had we had work that we wanted to do in reducing opioid use and misuse. And so we got connected with an organization called Family Against Narcotics. And the leader of that organization is Judge Linda Davis. She's quite passionate and she has a wonderful public narrative that really fits this structure quite well. And so I found she was interviewed for a health organization, a health magazine, and Jess is going to put that link in the box. And for your reference, for as you're developing your public narrative, I wanted you to take a look at Judge Davis's outline. Part of it was through her work. She worked in the drug courts in Michigan, and she found that police officers were coming to her all of a sudden, where there were one or two cases, all of a sudden there was this big surge in cases where people were getting incarcerated for narcotic use. And the police officers found that getting these people incarcerated was no help to them. They weren't getting recovery services or connected to anything. They were just getting penalized for their drug use. And so that was one motivating factor, very public. But then as time went on, she had a very personal story, and it's very emotional when she speaks about it. And I'm hoping to find a YouTube video on this, but at least in the written text that you'll see, she talks about her daughter who had a sports-related injury or something similar to that, having prescription drugs prescribed to her, and then a long time she became addicted to those drugs. And I know many people have heard these stories. This is very prevalent in the community, but she uses her own personal situation, something she thought would never happen to her, as another motivating force. Then she talks about her work with Family Against Narcotics, FAN, how she took that struggle for both her professional and personal life and turned it into operationalizing it into this community organization that helps family members work with their other family members who have addiction issues and opioid use and misuse, and how they've have support groups, education, information, and have actually done some interventions regarding this. They have quite a wide scope within their coalition. It's quite passionate. She's quite passionate about her work, and it's a great framework for looking at a public narrative and how she got people engaged in the work. So it's just an example, and I really wanted you to take a look at that as you're working on your public narrative as well. So public narratives motivate others to join you in collective action to address a challenge. So it's not enough to know how to address the challenge or have a strategy, but it's also, you need to be able to explain why addressing a challenge is necessary. So effective action requires both the strategy, the how, and the narrative, the why. So for example, we have a variety of evidence-based practices that we work through with our work with Superior Health, but, and we know they're very effective, but this doesn't mean that we inspire to change our way of work. And why is that? Because there is more to changing our behaviors than just that. Humans have two ways of mapping their knowledge. One is cognitively, of course, and that's through our logic and analytical selves, and that's the how. So many times we're using data-driven decision-making. We see an uptick in readmission rates, and so now we have to develop a strategy for that. Makes perfect sense. But there's another point that it's on a very different level, and that's our emotional level that motivates us to do things. And that's with our heart or our gut. And that's where we make judgments about what we value. And so most of us make the mistake of focusing only on the how. And that's when we are trying to lead a change initiative. But public narrative offers a framework for appealing to both the head and the heart. And so it encompasses both. And that's where it really seems to be quite an effective tool for getting people to join you in your work. So our values inspire our actions, and emotionally, they ultimately drive our decision-making. So knowing emotional information is just as important as knowing logical information. So when we think about Judge Davis's testimony with her daughter and how she was able to relate those experiences to others in the community, it really painted a whole picture of action, personal to public to action. So being able to instill your audience with the emotions that motivate them to collective action is really critical. So as leaders, we have to learn how to overcome the negative emotions of inaction, such as fear and isolation, and instill and stir up those emotions that motivate action, that motivate urgency, hope, and solidarity. And here you also see that YCMAD, that stands for you can make a difference. And you really can when you work as an individual working towards collective action with partners. So we really want each individual to understand that working together, you can really make a big difference. So when we think about the classic story of David and Goliath, what is this story about? It's been around for ages. What does it teach people? What's its aim? So it's thinking about this, about what values and emotions are really being activated here. It's a story that's told to illustrate and offer hope and courage. And it shows that the underdog can really make a big difference. It offers that sensibility that there is possibility, even as an underdog, that sometimes with creativity, some smarts, that they can actually beat the big giant. A leader helps their group of people to overcome the negative emotions through storytelling. So it's through stories that we illustrate our values, as with this one, as a historical perspective that's been told throughout the ages. It really does show how we can demonstrate what our values are. And even when I reference back to the Judge Davis story, she could have simply said that she just loves her daughter. But when she told the full scope of what happened to her with her daughter and her journey, that's when you get the full context of the emotion and her dedication to really working with a group of people in the community to create a change. And that's what our goal really is when we're talking about the story of self, moving to that public narrative. So now moving on and thinking about what are the elements of a public narrative. So storytelling is one way of illustrating our values. And through public narrative, it offers the framework for telling our story in a way that helps us to move people towards the action. So the framework has three elements: the story of self, the story of us, and the story of now. So the story of self asks and answers the question of why me? Why am I called to leadership in this change effort? What story can I tell that illustrates this call? So in the story of self, you're the protagonist of the story. So when we think back to my story, it was really that very personal thing that happened to me as a young child that kind of really, honestly, I can really vividly remember those details of waiting at that hospital and the stress, even as a 4-year-old, it was causing my mother and grandmother. If I can convey that to other people and have it relatable, that's my story of self. The story of us tells the story of community as a protagonist. So who we are as a people. What are the stories that the leader can share that illustrates how people as a group have previously overcome these challenges? When I start thinking of my home health work group and moving into us as a collective, they were competitors. The home health agencies really, that's one of the most competitive industries that I've ever dealt with. But when I could convey the importance of coming together and unifying and working on collective interventions, I really got a great group of people who used to be competitors, understanding the importance of sharing data, working on interventions together on a community level, and then looking at those outcomes to those interventions and how that benefited their patients. And one of my partners used to say, hey, there's enough patients for everybody. We don't have to worry about that anymore. How can we improve their quality of life? And I couldn't say that any better, but that's part of that public narrative. Then we move on to that story of now. That story of now, it's critical at that critical moment at hand to frame a choice between living with the world as it is and what it could be. So the bridge is the specific call to action that the storyteller invites the office to join in them in taking that action. So when I started talking about, would you join me in this home health work group? Because I want to see a world where no one has to deal with what my grandmother and grandfather had to deal with. Being sent home with no discharge plan, not having education on how to do the exercises or what is a stroke or how do you maintain your health now after a stroke? What kind of community resources are there? My dream would be that everybody goes home with a resource. Everybody has a plan when they're discharged and they feel truly that they can be their own self-advocate and get all the quality services they need. That would be my dream. So that's the story of now, what I would look at and strategy for how to get that action implemented. Joining the home health work group would be one strategy for moving that forward. So when we look at that specific ask, and now moving to like looking at the story of now in detail, it's critical that as a leader, you form the urgency of the moment. The intolerable condition, what would that challenge be? what does the real challenge look like right now? You have to be able to describe a vision of what it could be. And if the people joined you, what would the dream action look like? So that my grandparent people are alone, isolated, don't know how to access services. The dream would be that they're not alone. You're their partner. They're their own self-advocate and feel comfortable asking for help, and that they would get the services that they need at the time that they need them. That's my dream. The choice is the invitation to collective. So it's specific and it's rooted in a wider strategy of the campaign. If you're not asking people to take action in the service of their dream, you're not using the organizing theory of change, and the ask is critical in this situation. You really need to be very specific as to what you want them to do. Remember that the whole purpose of a public narrative is to motivate people to join you in taking action. Join my home health collaborative so we can act to create that dream. Think of this image as you and the people are standing at one side of sort of a nightmarish edge. It's very visual. They must take action to get to the other side, and the dream or the world as it could or should be. The pathway across the chasm is the strategic choice or the commitment that you as the leader are asking them to take. So when I think of superior health and some of the things that we do through our CMS contract that you've joined us in doing, the dream is for us to reduce readmissions and admissions for our Medicare beneficiaries, for increasing patient safety within the skilled nursing facility arena, and increasing immunization rates for people across the continuum of care for our patient population. Those are some of our dreams. How can we make them actionable? So when you're developing your story of now, it's time for you to start thinking of this. And this is, I'm going to give you some specific things to think about when you're framing it, and we'll break out into our sessions. So think about your own story of self and a critical moment in your life when you felt called to accept responsibility in the face of uncertainty. Remember that this is just practice. We're not judging anybody. This is a safe environment, and we certainly don't expect perfection, but we just want you to give this a try. And we also want you to imagine how this can make you affect your change efforts and be more effective as you're looking to increase your engagement in your intervention that you're thinking about, or your community coalition that you might want to look at developing. Think of it in that framework. So these are questions and prompts that will help you to craft your own link to the story of self with a story of now and a call to action. So in the story of self, it's, why am I inspired to a leadership role in this change initiative? What story can I tell that describes my call to leadership? And in the story of now, or that call to action, what is the urgent challenge that we face? What can we do together to overcome that challenge? And what specific action do you want others to join in you taking? What makes it so urgent? Why does it need to be done now? Okay. So it's important to remember some of these things when we're looking at these specific moments. You really want to paint a picture. To me, it was very emotional to talk about my grandparents. I hope I painted a picture. I think when you read Judge Davis's article, it'll paint a picture. But you want to think about specific moments, specific people, specific challenges, specific choices that had to be made. What were the outcomes and the values that were involved? This will help you frame that story. And so now we have a little bit of adaptation to these, but now this is the small group work that we want you to work with. So in a minute, we're going to have you break out. Jess is going to randomly assign you to breakout rooms. Each breakout room is going to have one of the four of us as a facilitator, and we all have our story of self. The goal is to make that story of self about 3 minutes. I know, I think mine's a little long. Actually, it's funny because people think that they'll go short, and you usually go long, but about 3 minutes. Then we'll let you kind of work on your own story of self, and it'd be great if you got to that call to action component as well. And then if there is time within your small groups and someone feels comfortable, we will have you read your story of self with call to action. And then we'll just do some coaching, some suggestions on how you could maybe make it a little bit more targeted or frame it in a little different way. And then we'll all rejoin the larger group and have a debrief after that.